along the same lines, I feel like teens also have problems when it comes to figuring out when they want to get help and how they want to actually get the help. So I wanted to ask, what's the threshold at which someone should seek professional help, or like how should they identify some of those symptoms and triggers?
Absolutely. I think, again, great question. So, first of all, I think it's really important to know that mental illness is not a choice. It's not something that teens are hoping that they have any mental health problems. In fact, it's important to know what is good mental health. And good mental health can mean feeling in control, being able to cope with setbacks or stressors, feeling confident, feeling good about ourselves, building and maintaining good relationships, or even managing and being able to express emotion. So this is what all constitutes a mental health, good mental health. And when some of these things are off balance, or one is struggling to, say, maintain good relationships, or they're seeking any kind of social contact with their friends, those might be the signs that, okay, this is maybe just more than, it might require more professional intervention. And, there are some signs to look out for. So, we all experience sadness, but it's not necessarily depression if we're sad. There's something more chronic about depression and anxiety. So it's like, maybe an example I can share is if you just have a normal common cold, you may not need to go to the doctor, right? You just go over the counter, you get your medicines and soup and all of that good stuff, and you might be fine. But if it's, say, more chronic flu-like, or you're missing way more school than you expected to miss because you're so sick, can't get out of bed, then you might want to go to an actual doctor, right? Because symptoms are more chronic, it's getting in the way of your day-to-day activities. So similarly, if we can look at mental health that way, if something, you got a bad grade and you're upset about it today, that's expected, it's normal reaction. But if, say, you're ruminating over that for several days, if you're, disconnecting with friends, you're not eating enough, you're not wanting to go to school, then it might be time to say, okay, I might need more professional help. And again, there's a great question, because I think even parents need to be aware of these signs, and so other things that, say, kids or teenagers often might struggle with, or they might show symptoms of mental health, it actually might manifest as bodily complaints. So more headaches than usual, more stomach aches, not wanting to eat again, or not sleeping enough. So these are some signs to look out for. There's a great article I read, and I wish I remembered who it was by, but it was simply stated, it's like these, I think they said 4 L's, like 4 L's to remember, to know when it's time to maybe seek help. So is a teenager able to live, laugh, learn, and love the way that they usually do? If these 4 things in some way are off balance, or something's getting in the way of their ability to meet these 4 L's, then it's maybe a sign to seek more professional help. There are also some invisible signs, Arjun, like, in the sense if somebody's feeling more, say, hopelessness or helplessness, or feeling worthlessness, or their self-esteem is really feeling low. These are, again, some invisible signs that, people may not be able to see. And kids or teens, as you know, they're pretty good at covering things up. They're pretty good at white lies. So they might tell their parents, no, everything's fine. And they might come off as, they know exactly the things to do to make it seem like they're okay. But this is more so that they are aware that, okay, if I'm actually doing a good job at showing I'm okay, but internally I'm feeling that sense of worthlessness or poor self-esteem, might be time to seek some help. Even negative thoughts, we all have negative thoughts about ourselves. We all have self-doubt thoughts. But again, if these become more persistent and you're having a lot of negative thinking, then again, those might be some signs to seek help.
And moving on from these signs, I think maybe some teens are often able to identify these signs, right? And they may see it in themselves, but I feel like a problem, especially with teenagers, is they struggle or feel kind of embarrassed to actually approach someone who can help them. They're kind of, they want to solve the problem themselves when they get the problem because they don't want anyone to know about it, right? And so they're really reluctant
Mm-hmm.
to seek professional help. So how do you recommend they approach someone like that?
No, I think you've nailed it. That is one of the, probably biggest challenges for anybody to seek help, but it makes it even harder for teenagers who like to keep things private, and they might not feel comfortable talking about certain things with their parents. And so I think first of all, it's like this is really, going to this is about addressing stigma, right? So we all have kind of these biases about mental health being, if we have any problems and it's bad, or we need fixing. And these are honestly just myths, just like I mentioned, when we go to the doctor if we have a flu, or if we have diabetes, or we have more chronic conditions, right? We have no problems with that. But for some reason, our society has made seeking mental health help, there's the stigma. And I think it comes from, being listening to these social messages that if you cry, you're weak.
Yeah.
But that's not true. These are just messages we have internalized. And so it's really important for teens to kind of be almost like scientists, like, okay, let me check that. Is that really, we've been doing a lot of fact check lately, right? We know for various reasons. So I encourage and I invite teenagers to do a lot of fact checking for these messages that are out there. Okay, just because I feel anxious and I need help, does that make me an actually weak person? Is that true? And I think a great thing to do, an exercise that, again, I invite teenagers to do, and maybe even adults, is what would you say to a friend? So talking to ourselves like we're giving advice to a friend. If your friend comes up to you and says, I got dumped and I feel so bad about myself, you're not going to tell your friend, yeah, and they also thought that you weren't very pretty, and yeah, you also gained like 40 pounds, right? You wouldn't say that to a friend. But somehow we say these negative things to ourselves. So it's really important for teens to talk to ourselves like we're talking to a friend. Yeah, so it's really about reducing that stigma of mental health, to be able to access that. And I think for parents to also normalize that it's okay to not feel good and to seek outside help sometimes. So that's a really important piece too. And I hope parents do see this blog for you, this video of yours, because I think the onus falls on both the teen and the parents to reduce the stigma. And I think it's also important to know, when can teenagers consent to treatment. So every state has different laws, and not all the time minors are able to consent to their own treatment. I believe in California the age is 12. So your parents don't have to sign off on paperwork to be able for you to seek help. Of course, there are limitations in the sense if there is a serious risk to the teenager's safety or other safety, then the therapist might be mandated to actually let the parents know or law enforcement know. But that should be discussed before any kind of treatment starts anyway for the teen. So the teen is already informed about what are my limitations, when does confidentiality get broken. So but in terms of seeking help and making that initial contact with a therapist, one does not have to be 18. And now after COVID, it's amazing how many therapists have actually shut down their physical offices because they're all having to do everything online. So one way to look at it is also, teens can have access on their phones or their laptops to meet a therapist. So, again, it's about access. So if access is there, then hopefully the teen can feel more at ease about seeking that as well.
Thank you, Dr. Mehta.